Sensory processing can be tough. The head banging, the picky eating, the meltdowns, and sometimes the oddly specific needs for things like very soft fabrics or never wanting to wear shoes or only wanting to wear shoes can leave you on the verge of giving up as a parent. But I want to show you how sensory processing is a neurological issue that can be corrected if you know what to look for. Hey, I'm Dr. Sam McDonald. I'm a brain health expert, and this channel is dedicated to helping you rewire your brain so that you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So I want to begin with how does it start, right? Where does sensory processing come from? Because that's one of the most common questions that we get is, well, how did my child get this? Or where does this really occur from? What's the cause of it? And through studying the research and talking to and working with other practitioners that have seen hundreds, if not thousands, in combined sensory processing cases, one of the most common underlying factors that we see with kiddos that struggle with sensory processing is birth trauma. And specifically when I'm talking about birth trauma, I'm talking about a kiddo who was born either by C-section. This is actually, there's a higher percentage of kiddos born by C-section that have sensory processing, and also vaginal birth, specifically where the forceps or vacuum extraction is used. Why this is important is because when there needs to be some kind of intervention with a kiddo being born, there's a greater likelihood of damage to the area of the brain right here called your brain stem. And how that occurs is through what's called an axial traction maneuver. So what happens, they're trying to pull the baby out, because at this point, the most important thing is getting the baby out safely so that they can be alive. But what's never evaluated is potential damage to this upper cervical area here called the brainstem. Brainstem is super duper important in neurology. This is one of the most neurologically rich areas in the body, and brainstem is responsible for a lot of different things. The most foundational stuff in our body is in the brainstem. This is your essential life functions, your heartbeat, your breathing, your digestion. All the stuff occurs here. Now, specifically in our office, when we're looking at brainstem function, especially for kiddos both under the age of 1 and over, we're looking for what are called primitive reflexes. Primitive reflexes are the foundational training wheels of the brain. Their whole job in this first year of life and primitive reflexes, for those that don't know, these are the reflexive movements to help the brain grow and develop. So these primitive reflexes, after a certain point, after that first year, they should go away because the brain now has matured enough to inhibit or turn these reflexes off. But what we see in the office is kiddos that have sensory processing. Almost, I'd say 100% of the kiddos that come in have some kind of retained reflex, which means that there's some kind of immaturity happening there in the brain stem. And if we look back through the case history, we'll often find that yes, there was some kind of intervention that was needed with a kiddo in the birth process. What that's also going to mean too is that if there's damage to the brain stem, they're not going to start to regulate their fight or flight and survival mechanisms and relaxation mechanisms appropriately, meaning that the kiddo is going to be more susceptible to stress, which is going to lead to those heightened outbursts of behavior because their system is already at this higher threshold of stress. They're not perceiving their environment in a safe manner. Thus, any type of stimuli coming in is going to set them over the edge. So they're already a kiddo that's at a heightened threshold. Something comes in, boom, they're over the edge. And now you're seeing these meltdowns or you're seeing these other types of behaviors because they're looking for some kind of way to soothe an already chaotic internal environment. So when we're checking for these kiddos, one of the biggest things we're looking for are these retained primitive reflexes, which is a signal to us of brain immaturity. So the next area that we look at when we're working with kiddos with sensory processing is we're looking at the cerebellum, which in the back of the brain here, it's also known as the little brain. It's commonly known for being responsible for things like balance and coordination, but new research has also shown that the cerebellum is actually very active in coordinating thoughts for the brain. And specifically too, it's almost a way station for information coming in from the body up to the brain as well. So what we'll often see again with these kiddos with sensory processing is that information's coming in and at some point it's getting scrambled from the body as it's entering up into the brain to be processed. Right? So all of the information from the body is coming in, whether it's touch, vibration, pain, temperature, light touch, and deep touch. All these information has to come in. It has to be properly integrated or gated or potentially inhibited that's going to get up into the brain. So the cerebellum has a big role in that. It's one of the first gates for that. But often what we'll see with these kiddos is as that information is coming in, think of it like moving along the highway, and all of a sudden as it gets to the brainstem area where I talked about with those primitive reflexes, it's like it hits a gravel road and then it's got to take a detour. And as it takes a detour, it gets up into the cerebellum, and we're playing a game of telephone here, that message starts to get changed. So instead of maybe someone who's wearing socks, they can't process the proper information to this sock is nice and soft and it's comfortable. Maybe for them it feels really itchy and scratchy, which is why they never want to wear it. So all day they're getting this information from their feet up to the brain. It hits the brainstem and goes into the cerebellum, and instead of this sock feels soft, now the brain's getting this message that this sock feels scratchy and it's uncomfortable and I can't turn that message off. That's all I can think about. Or they may have this internal sense in their body where they're not shutting off the pain reception or pain receptors in their body, which can lead to things like head banging, because they're looking to try and shut off that pain response coming from somewhere by doing another action and stimulating more proprioceptive or what's called mechanoreceptive stimuli, changing that message. Because it's all about what the brain is getting and receiving from the body. This is really an input problem coming from the body and that message getting lost. And then finally, the last place that we look for in the sensory processing follow the leader game is what's called the parietal lobe, so this back part of the brain here. And this is really where our what's called somatotopic map exists in our brain. This is our map of our body and where our body is at in space. So this is often described with a big fancy word called proprioception, and this is where your body is at in space. And one of the biggest issues that we see with kiddos with sensory processing is that they have very poor what's called proprioception and also very poor neuroception, which is that brain-body connection and knowing, hey, where's my body at? And more importantly, what's my internal environment like? The analogy often described to parents is that if they're in our office, it's a very calm and comfortable environment. I often use the analogy if it's more like classical music, but for a lot of these kiddos, they may experience this environment as like Metallica or like heavy metal. And all they're doing is hearing this constant heavy metal environment, and that's what their body's perceiving, which is going to put them into this more stressed out mode. And now combine that with potential brainstem dysregulation that I spoke about and cerebellar dysfunction where they're not getting the proper messaging up to the brain. This leads to this now kiddo who you think should be experiencing the world in this certain way, and they're not. They're experiencing in a way that is often distorted and not appropriate to what's going on, which is going to lead to these abnormal behavioral outputs. So it's really important to understand what's happening in all these different neurological layers, because they all are going to tie in together. So the primitive reflexes in the brainstem, the cerebral movements of how it's coordinating the thoughts from the body up to the brain, and then most importantly, how the parietal lobes are then taking that information, and then really what actions are they doing with it? Are they sending the appropriate information back down to the body for it to do what it's supposed to do? So as you can see, this can get really complex, but the cool thing is this often changes very quickly because kids' brains are very plastic in the neuroplastic model of rewiring. So stuff can change if we can start to get the brain properly regulated, getting them out of this sensory storm, meaning that they're stuck in this fight or flight state. We can get them out of that super stressed survival brain mode back into a healing mode, and let their brains start to really perceive their body in a way that they really never have before. So on that note, you should be healthy by choice, not by chance. And for that reason, I will see you on the next video.